2025 has been a year of important birthdays. Medicaid turned 60, and the Institute for Medicaid Innovation celebrated its 10th birthday. IMI is a special place. Founded in Washington, D.C. by Dr. Jennifer Moore, it was fueled by her personal experience with the Medicaid program and her passion to ensure that all people have equitable access and coverage. In 2015, IMI had a name and a leader, but it needed a mission and a vision. To create that, we assembled 24 national Medicaid experts in Washington, D.C. to participate in our first National Advisory Board meeting. We used a mind mapping exercise to visually, and for some, artistically, articulate what the organization would represent for the nation. A common theme emerged. Most maps placed the individual, family, and community at the center. The areas where IMI would focus were represented as spokes on a wheel, petals on a flower, planets in the solar system, or clouds surrounding a hot air balloon. At that moment, IMI had its purpose. This visual theme has carried forward throughout IMI's history, starting with our first website and continuing to our current graphic that articulates what we do. Over the past 10 years, our mission and vision have not changed. We improve the lives of Medicaid enrollees through the development, implementation, and diffusion of innovative and evidence-based models of care. We promote quality, value, and equity while engaging and centering the voice of individuals, families, and communities most impacted by the Medicaid program. The Institute for Medicaid Innovation has become known as a leader because of how we work. We convene the experts, we share knowledge and build community power, centering the voice of Medicaid enrollees, and we deliver evidence-based models of care and actionable insights. What sets us apart is our core value focused on the more than 70 million people enrolled in the program, and our commitment to ensure that all voices, every Medicaid stakeholder, are at the table to inform, guide, support, collaborate, partner, and lead IMI initiatives. In 10 short years, IMI has published more than 300 fact sheets, ranging from a deep policy dive into each state's Medicaid program to findings from our annual Medicaid Managed Care Organization survey. IMI has published more than 80 reports, best practice compendia, issue briefs, and toolkits on topics including behavioral and physical health integration, the role of high-value evidence-based maternal models of care, value-based purchasing to reduce disparities, and family experiences with programs designed to reduce childhood obesity. We have hosted 5 multi-year virtual learning series on child behavioral health, doulas and community-based services, and the midwifery model of care, and held more than 50 webinars on other salient Medicaid topics. We've led 8 national learning collaboratives, providing expertise and support in 46 states, with each team comprised of representatives from state Medicaid agencies, managed care organizations, provider groups, community-based organizations, and most important of all, people with lived and living experience. We've received funding for 66 of the 68 grant proposals that we have submitted over the past 10 years, totaling more than $25 million. More than 40% of project funding has been used to pay individuals, families, and communities to serve as experts to guide the work and participate in our initiatives. We honored 50 exceptional nurses across the nation who are responding to the COVID pandemic by ensuring that their patients and members continue to receive healthcare services and social supports through the Medicaid program. And we have selected more than 300 community-based organizations and Medicaid health plans for having a best practice or innovative initiative through a highly competitive and rigorous evaluation process that identifies the best of the best across the nation, amplifying positive stories about what Medicaid can accomplish. Those are some pretty impressive numbers, but they would not be possible without the people behind them. IMI depends upon its volunteer leaders, almost 800 people in our 10-year history. Our governing board members have provided essential expertise. We have welcomed 42 National Advisory Board members to serve, providing us with expert guidance as we have navigated changes to the Medicaid program and sought to fill gaps where knowledge and evidence were needed. And behind the impressive number of high-quality deliverables has been a small but mighty team. IMI started with just 2 staff, then grew to 3, and only recently expanded to 12. We've also had 40 summer interns and 12 fellows. Each one earns an IMI Medicaid superhero cape to take the knowledge they have gained and their passion for this work with them into their careers. And if articles in JAMA and Health Affairs and a Chelsea Clinton tweet about our research weren't enough to convince you that we do important work, perhaps our partners can. We'll let them tell you about our work in their own words.
Fun fact, I'm one of the original board members for the Institute for Medicaid Innovation. It's one of the things I'm most proud of. I think about why we started, how we have grown over more than a decade, and the ways in which we have deepened our skills that make us ready for this moment. The Institute for Medicaid Innovation has had incredible relevance and impact. Relevance in that we have identified issues that maybe others didn't choose to pick up and focus on, and then filling in the gaps with data and deeper understanding from various perspectives to include the people being served by Medicaid. Happy 10th anniversary, Institute for Medicaid Innovation. I am celebrating in every way all that has been accomplished, and I'm looking forward to the ways in which the foundation we have built will expand and grow and create monumental change.
It's fun to be part of a group of people that are doing that in really creative ways, innovative ways, and doing it with a sense of joy and fun and a sense of humor.
First, congratulations. 10 years is a very big feat. Thank you for continuing that connection, and also thank you for continuing to give us those resources. I feel that IMI is not just taking and taking and taking from organizations, but really creating that bi-directional learning and those opportunities for folks to continue to stay connected with one another.
To 10 more, to 20 more, here's to more birthdays at IMI. One of the unique aspects of IMI is that there's stipends for people. I think it's also so unique, again, that there's so many walks of life, so many experts. My favorite piece is the lived experience, folks. We really are building something together, but with the folks who are most impacted's voice leading the way.
Thanks for the co-facilitation, for the creating the space. I mean, last year you literally opened up your own space to host. There's something pretty profound about the approach that you've taken. It's not linear, it's a journey.
We need agencies outside of government looking for creative ways to innovate with regard to Medicaid. It is a tremendous resource, and the solutions to how to make it better can't always come from within the government. And so to have an external agency doing this, and that you find the funding to do things, to come up with brilliant new ideas, is really meaningful. And so happy 10. 10 means something. 10 means you exist, you have existed, you're successful.
I didn't even expect that to make me emotional. But thank you. I want to thank IMI for magnifying my voice, for being an organization that holds true to the smallest issues of my heart. You know, I had no idea that there was a nonprofit organization out here that is rallying for things that you really want to change in the world.
But our favorite story of impact comes from our very first grant-funded project and convening meeting focused on childhood obesity prevention and treatment. This story, shared 10 years ago, has inspired and guided every single project at IMI since then.
We had pipe cleaners and Play-Doh and things to play with at our tables, and the kids were making things, and one of the mothers made a little flower, and she said, I made this because I feel so blessed to be part of these programs, and I wanted to give this to my program, this little flower, because she felt so blessed to be part of the program. So that didn't surprise me, but it moved me, that the meaning of these programs to the families. They really feel that these programs are a gift.
She made this flower
dando gracias al programa
to say thank you to the program
y por tener personas que se preocupan por la familia.
And for having people that care for the families.
Y muchas gracias.
And thank you very much to everyone.